wasn't. And more recently, Zika. So in essence, it means that there must be a mechanism by which we develop drugs, and there is funding, there is some coordinating mechanism. And that also, we have a way of prioritizing access. Now, these are ideas that have been floating and debates that have been going on for years. We've seen from Madam Dreyfus' report of CIPIH, we've seen through the Global Strategy and Plan of Action on Public Health, Innovation and Intellectual Property that was agreed to by member states. But there are still areas of work, and hence the need for this high-level panel. We need a right mix of policy options in this long walk that can help us not only improve access, but ensure that there's policy coherence between public health, intellectual property, as well as the rights of individuals to access care. Thank you.
Thank you, Precious. And now over to Lorena Di Giano. She's a member of the expert advisory group of the high-level panel and the regional coordinator of the Latin American Network for Access to Medicines. Lorena, over to you.
Thank you very much for all of you to come and the interest in the work we are doing. First of all, I want to thank Secretary General for inviting me to be part of the expert advisory group for the high-level panel. I'm very honored to be in this role. As a woman living with HIV, I know myself very well what treatment means for life. I'm coming from Argentina, and I would like to highlight the situation, the particular situation that people in middle-income countries are facing. International efforts, including policies, funding, procurement, are leaving behind people in middle-income countries. Due to monopolies generated by pharmaceutical patents, the life of millions of people around the world are threatened. Price of essential medicines are out of reach of these people, and the establishment of the high-level panel means a great expectation that should not be betrayed. It is very important to consider how a person feels when you wake up in the morning, and the difference between having or not having the medication what you need for your health, for surviving. Communities expect countries to be actively supporting the work of the panel. The campaigns against the work of the high-level panel are unacceptable and must be stopped immediately. I would like to refer also why countries are not using TRIPS flexibilities. This is a very important issue because TRIPS flexibilities are really legally instruments that are in the TRIPS agreement that countries have the right to use to protect public health. But what happened to countries like Argentina or Brazil that are using the main flexibility that is to define the criteria for patentability of pharmaceutical patents? We are now in Brazil and Argentina being sued. The government is being sued by pharmaceutical companies. In Argentina, for example, the patentability guidelines are being attacked by a judicial case by 26 pharmaceutical companies. Civil society organizations in both countries, we have launched the Drop the Case campaign, Big Pharma Drop the Case, because it is really that governments should be safe to use TRIPS flexibilities because we need essential medicines to be affordable. These measures that Argentina and Brazil are taking is to better administrate the patent system, to protect the system of abuses. I will give an example of that is in a WHO report that analyzes a specific hepatitis C medicines. And it was found that on sofosbuvir is a key new DAA medicine to treat hepatitis C. And WHO found 21 patent applications on the same molecule. So this cannot be, this is an abuse, because this extends monopolies and gives exclusive rights, and no generics can come to the market. We need really a substantial reform on the system, because the system is not really bringing real innovation. And we need the technology to be accessible for all, not only for few people in countries where they can pay for the medicines. Today, I stand in solidarity with activists from all over the world that will march for the rights of those colleagues and friends who couldn't live to see the conference coming back to Durban. Because they could not access the medicines that they need to keep alive. Today we stand together for the right to health for all people, irrespective of where they live and what the disease they may have. Thank you.
Thank you, Lorena. It's now my pleasure to open the floor for questions from members of the media. Any questions of clarification or more substantive questions? We'll take a number of questions and then the panel will respond. Please.
Hello.
You stand, please, as well, just so we can see you.
Not sure it's on. Is it on?
Yeah.
Okay. My name's Sarah Bosley.
You've got to talk close.
Health editor of The Guardian. Question actually largely for Madame Dreyfus. Could I ask, my understanding is there's been quite a lot of pressure from the pharmaceutical companies behind the scenes during the discussions you've had about your report, which I believe is now in draft form. Are you able to say anything about that and whether you would resist pressure from the pharma industry?
Please.
Thank you very much. My name is Byron Adonsim Tingwende, the editor of Spiked ZW, online from Zimbabwe. My question is, there appears to be problems around intellectual property. What is the level of engagement with, say, the ARIPO, the African Regional Intellectual Property Organization, or the International Property Organization? What is their representation at such a meeting? I thank you.
Thank you. Shall we take a few more questions? Any other questions or comments?
My name is Helen Go for Cameroon Radio Television. Many middle-income countries, like my country, Cameroon, relies a lot on the Global Fund to fund its AIDS programs. My question is directed specifically to the UN Secretary General. What can you say, what should African countries do to support their programs more and not rely exclusively on external help?
Okay. Before we hand over to the panel, please, last.
Sean Bambra, the Varsity, Toronto, Canada. This is for the panel. How do you feel that the Trans-Pacific Partnership and new trade agreements will affect access to essential medicines, especially in the context of HIV/AIDS?
Thank you very much. I'm going to hand over to Madame Dreyfus, the co-chair of the high-level panel, to respond to the questions. So the first one is very much about pressure behind the scenes and how the panel is coping with that. Another question about how intellectual property organizations at the regional and at the global level, ARIPO or WIPO, are involved in the work of the panel. A question about the Trans-Pacific Partnership, a big trade agreement, and how we see how that might be affecting HIV. And there was one question over there that we'll come back to that for a clarification from the person who asked the question. But those three, over to you, Madam.
Thank you. I wouldn't speak about pressure, or we are so resistant to pressure that we do not feel them. That's possible also. But I can just say that we had representative of the pharmaceutical industry and the generic industry, the innovative and the generic industry in the panel, and they were real good members, and they wanted also to bring a result that is a result going beyond the situation of today. So no pressure or no sensitiveness to pressure, Madam. The second question was on the participation on the other agencies who are responsible for IP or for trade. I can say, and perhaps this should be added also by Mandeep Dhaliwal, that in the expert advisory group, they were all represented and very active also, and we received from them many inputs that we took into the large range also, the 182 contribution we received from very different sides. As somebody living also in Geneva, I could witness also the common work that is established now between WTO, WIPO, and WHO, and I think what we are trying to do and what the Secretary General wants is to bring the coherence in the international and among the international agencies and organizations stronger, and to help to have a real common coherent position. Because when we are speaking about incoherences in the different law and legal systems, I think there is also incoherences or difficulties to have a common view between different agencies, and our panel has the duty to help to more coherence between also this agency, and they were associated to our work. Now on TPP, I mean, this is something, and I made some brief allusion to that in my short presentation. It is clear that from the time of TRIPS and Doha, there was a movement to fragilize these flexibilities in different free trade agreements, and that can be the TPP, but it can be also regional agreements or even bilateral agreements where countries renounce to some flexibilities for other advantage. But in our view, clearly, this other advantage cannot be considered legitimate if they threaten the right of health and the human rights.
We had one final question from a member of the media asking, and maybe Madame Matsoso will give this question to you, about what do we expect from African countries to be able to deliver treatment to their people?
It was more about funding as to how we can consider this. I can say that we've looked at innovative financing, for instance, that is based on airport tax. That was followed by the few countries led by Brazil, Norway, as well as other countries like Chile, France, and so on. I do not see why African countries cannot follow the same approach of coming up with innovative financing mechanisms. Airport tax is one, but there are other floating ideas, for instance, with the red ribbon, which is based on the transaction tax arrangements, where people use their credit cards, and they can be, for every cent that is collected, it can be put into a pool fund. There are a whole lot of other innovative ideas using mobile technology transactions to look at financing. And those are the kind of things that can be discussed in the continent. There are a lot of people using mobile phones now, and you can raise financing through those innovative ideas. But I just want to say that we've seen also with civil society organizations that have come up with ideas that also raise funds. MSF, for instance, fund most of their initiatives and activities, and I do not see the reason why these kind of approaches cannot be followed. Thank you.
Thank you, Precious. So I think we have to get ready. There's another press conference starting in here. On behalf of UNDP and UNAIDS, who are the secretariat to the high-level panel, we would like to thank you very much for your interest and for coming out and asking questions. It's important. The report will be out soon, and will be delivered to the Secretary General very soon. So we hope that you keep your eye on this process. I'd like to thank Excellency Secretary General for his leadership in establishing the panel. Thank you for being here with us today. Thank you, Madam Co-Chair, members of the panel and the expert advisory group. Michelle, thank you very much for your leadership. And